Hey, it's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and I'm going to share with you a little hack and I'm going to call this an advanced hack. So this is not for new Invisalign doctors. This is not for doctors who don't have their systems and operations and virtual monitoring in place. You need to have virtual monitoring in place in order to do this hack, and I can't say this again. That means using an approved program like Invisalign Virtual, Dental Monitoring, or In-Hand Dental, or some of the other ones that are out there. You need to have your patient set up on the Practice app for these systems, your office set up on the Practice app for these systems, and you need to already be checking in regularly with your patient. Why? Because if you attempt this, and you do not do this, weird and very, very bad things will happen that are going to be irreversible. And I cannot say this enough. So I actually hesitated even posting this hack, although I've got a few doctors that are using it. It's working miracles for certain kind of conditions. I also kind of jankily did some screen photo art on an aligner, because sometimes when I share actual things, a property of even an aligner that is from Align Technology, they get upset at me. So this is just a stock image. I can do whatever I want with it. So this is a hypothetical, and it doesn't just have to be Invisalign. This can be any aligner company. So without further ado, let's talk about weird deprogramming needs, specifically after using the active feature of Invisalign with MA, or if you've got some type of strange interference, CRCO shift, and you just need some general deprogramming. Like, you don't really know where the bite is supposed to be. You know it's not right, but you don't want to do some crazy treatment plan adding all kinds of sequential distalization or IPR if you're not 100% sure you're needed. This is a hack for you. So what you do, and it doesn't cost you anything. Well, I mean, it might cost you like $10 in shipping, because you're going to put this through as a refinement, and not all aligner companies are going to let you do it. I've definitely done it with Invisalign many, many times. I've got a case I'm about to do with ClearCorrect. I will, if it doesn't fly, I'll post an update. I haven't done it with any other companies. I have done it with global white label aligner companies. So yeah, I mean, I can't promise it'll work, but this is the why. And you're going to have to really explain it. This is not like a thing that's in their thing. You have to like literally dream it. Now, the reason why I don't just want to take the previous aligner and cut it at the 3s is because you will not have enough retention, even with just some facial attachments, to keep it in at night. And my ultimate goal is not to have the patient choke and die. Okay. And by the way, if I am giving you this advice, you got to use your best patient. I'm not saying this is okay. You know, this is a hack that sometimes dentists and orthodontists do, where we do short trays to let the bite settle, but we're gonna make sure we have crazy retention first, And sometimes I'll even have the patients and parents sign that this is a potential choking hazard and they're taking this risk, as opposed to maybe doing some bonded retainers as an alternative. It's always an alternative. You can throw upper and lower bonded retainers on. So if they are uncomfortable with the bonded retainers, which by the way will take you time and money to do, but definitely done that, then this is an alternative that is free and removable. So you might even want to create a special document. Okay, so I'm not saying this is legally okay. I'm just saying this is orthodontics, and a lot of times we do Jimmy Riggs MacGyvers to try to fix things. So what we do is we do a refinement, but we ask for only a 3-to-3 tray. Okay, so you don't use your old tray. You do a refinement. Okay, you set it up, all the movements that you want to set it up, okay, with the posterior and anterior teeth. Then you say virtually remove all the posterior teeth, the 4s, the 5s, the 6s, the 7s, and the 8s if you have them. Just a 3-to-3 tray, upper and lower. That's all you say, okay? So it's going to look like this in the software. Then you leave all the facial attachments on that it came with, maybe even add more. I usually add to all of them. That's the pinks. And then you add at least 2 lingual attachments, big chunky guys on the back, okay? That should click it in pretty darn good. Then the patient is going to wear this full time, but you're either going to see them in your office every week, or you're going to put them on virtually monitoring every week. You put them on virtual monitoring every week. They need to have articulating paper. They need to know how to use it. They need to be taking their photos, okay? This is one of those situations that if you dispense this, and granted, you're only giving them one tray at a time. They can come back to, if it seems that they still need more settling, they can come back to get the next one. I'm not dispensing 5 trays, 4 trays, 3 trays, one tray only, because I want them to come back after a couple weeks, And if it gets gross, they can come back. They can put their booty in your chair, and you can check it, okay? Because that way I feel better. Like I said, they're gonna be on a short leash. And ultimately what I'm looking for is deprogramming. I'm looking for the bite to settle down in the back. I'm looking for the interferences to go away. I'm looking for better posterior occlusion. Once I see solid posterior occlusion with the tray out, then we're going to discontinue this tray. Then what we're going to do is we're going to go ahead and scan or impress for a super fast, hopefully in-house retainer, okay? If you can make it in-house, even better. If not, find a local lab. I don't really love the idea of you sending out to Invisalign because that'll take 2 weeks to make a retainer. So this is where you might actually have to pay for something. It needs to be like fast because we don't want to overcorrect it, and it's always going to be settling. So super fast, some type of like, okay, we're there. Let's just retain this retention, you know? I mean, worst comes to worst, I'd rather there be nothing worn or maybe just wear this only at night and not during the day, but the back teeth will continue to settle. That would probably be the happy medium. Can't promise that would work. The immediate retainer would be better, but that would be better than wearing it full time where it'll settle more and perhaps turn into an anterior open bite. That's what we don't want. And that's how that works. And then you can just go on with your regular refinement after you've deprogrammed it. It works amazing. I've been doing this on almost all the MA cases. Forget this TD, TG, TV, whatever this stuff is. That stuff doesn't work. And again, anything I tell you, you know, if Invisalign, you know, is listening to this, this is just based on my 20 years experience. These are tips and tricks to give you guys better outcomes with your Invisalign cases. Ultimately, you're the licensed doctor. You make all the decisions. This is just a YouTube video, so with tricks and tips, and these are meant for doctors. So definitely not meant for consumers. All right, thanks so much.